Howdy, howdy. Welcome back to Let's Get Oral podcast. I am Jonathan, and once again, I'm here with my lovely co-host, Camille.
Hello, hello.
And today I know, we always talk over each other. I love it, though. And today, we are very fortunate to be sitting with two guests. So we got a twofer, which just tends to be different. We're sitting here with the co-founders of the Mouth Lab, with Angelina, Geon, and Jazmin, Platero. They are both clinic and academically trained dental hygienists and researchers who a couple years ago, I believe after meeting in a practice, they had some questions and inspiration to really learn and help people more beyond what was happening in the practice. So Angelina and Jazmin, welcome to the pod.
Hi, thank you so much for having us. We're so excited to be here.
Yes, this is such an exciting conversation that we're about to have. I can't wait.
Absolutely. And first, we usually like to kind of start at the beginning and understand y'all's journey. But with it being both of y'all and wanting to hear both, could you actually tell us first, how did y'all meet?
It's an interesting question. Well, we met at our last job, but the way life brought us together is actually pretty interesting. But I had applied to work at the place Angelina worked at for a front desk position, and somehow ended up being her assistant.
Wow. Okay.
Yes, it's quite an interesting story.
Mm-hmm. Yeah, I when I saw Jazmin's resume, I knew firsthand that she was not going to be a front desk person. I was like, this resume is just way too good. I was like, she's a super smart girl. Not that people at the front desk aren't smart, but I could tell that she had a more scientific brain. And I was like, she needs to work with me. I felt like it was destiny. I felt like she was like my younger self. And I was like, oh, this is it. And it turned out we worked out really well together. But I had been in traditional hygiene for a lot of years. And kind of like most hygienists, you start to get disappointed because when you get out of hygiene school, you're like, I'm going to go cure gingivitis and, nobody's going to lose their teeth. And actually you see quite the opposite. What you're doing is just managing them until they slowly lose their teeth. And it wears on you so much. And I was with my practice for a really long time, and my doctor was like, I'm gonna retire. Maybe you should start looking for another job. And so I went out and started looking for jobs, and I came across this practice that was a holistic practice. And I was like, I really don't want any part of that. I think they're going to be weird. They're going to be doing like all this strange stuff. And the doctor at the time, he was just kind of getting into the holistic world. And so still doing some of the traditional type things. And actually, I didn't even want to go to the interview, but my husband was like, just go, you never know, it might not be that weird. So I went, and it really wasn't that different. And then I started, so I was like, well, if I'm going to do this, I want to do it the right way. So I started kind of looking into more of the holistic or biological world. And what I found was total opposite of what I had thought. It wasn't actually anything weird. It was more how hygiene should have been the whole time. It was actually focused on preventing the disease to start with. And that's really what I had wanted. And so long story short, I wound up diving in head first. I went to the IOMT. I got my certification for hygienist, and I really saw a difference. It was rewarding for me professionally and for my patients, because once I started treating my patients in a different way, once I started looking at the bigger picture, their health started changing. And so instead of feeling like it was that constant uphill battle, it was, that hill had kind of leveled out there a bit, and it was just probably the best decision.
What were the key differences in your treatment paradigm? Like what is a traditional versus now what you should have been treating like the whole time?
Yeah. So I think, the biggest difference for me was wrapping my head around fluoride, right? So when we're in school, we're like, fluoride, you can't live without it. Like, your teeth are just going to fall out of your head if if you don't get your fluoride treatment every 6 months. And so for me, kind of taking a step back and thinking, hey, am I really going to see an increase in cavities in my patients if I stop giving them fluoride? And actually, that wasn't the case, because I started looking at it from a wider lens. You know, what's their vitamin D level? What's their what are their minerals like? What's the pH of their mouth? And so I had so many more tools to look at versus let me just slap some varnish on and hope that this sticks and does the trick for the next 6 months. And that really wasn't the case. And probably another big turning point was as we had grown in that practice, I had wanted to start bringing in salivary testing. And once I brought in salivary testing, that made the biggest change in our practice, because I think it is for a lot of people. We start to see when patients aren't used to salivary testing, and neither are dental professionals either. So a lot of times they're like, once I have this data, what am I going to do with it? Because it's not going to change anything. And that's actually the opposite. Once you do have that data, everything changes. And so that's kind of what I felt.
I'm sorry, if you were at your old practice or your first, like the first pass, and you did testing, would it have changed anything, or did, your certification kind of open up some ways of operating that were in fact different?
I think the certification is really important. It gives you a good baseline, but I don't think you have to have that certification. And honestly, I don't necessarily like the holistic or the biological label, because I think a lot of people, like how I was, maybe get turned off or, are questioning that title. But I think what it does is the testing opens up so many more questions. Like, so if the pH is high, why is that pH high? If I have some other high biomarker, why is it that way? And so you begin to start chasing those answers. Like, how do I change this? How do I get that pH level down? How do I reduce these high-risk pathogens? And then once we find those answers, then we can start treating our patients differently. And so, things that we use in biological practice, like ozone or different therapies, those are great. It may not be for every office, but there's other things that you can use.
Mm-hmm. I think that's one of the most important things about shifting into this more biological, holistic, functional world is the way of thinking, the train of thought that goes into how you evaluate and assess every patient. So it goes less like A plus B equals C, and then it turns into A could be a result of a precursor to that, or it's just a way to like widen that lens, like Angelina was saying, a way to really think critically about each patient as an individual and not what does the equation say that I should do next.
Absolutely. I do want to follow up on Angelina, if you could give us a little bit of background on what keyed you off on Jazmin's uniqueness when you first identified her as like a collaborator.
I think that one of the biggest things that I saw in her was critical thinking. A lot of us do have critical thinking skills, but that's one of the things that is very difficult to teach to change somebody's mindset, is to think critically and ask the questions why. Why is this happening? Why did this happen? And what can I do to change it? But critical thinking is such an important part. To get into hygiene school, you have to have like the best grades, the highest GPA. You have to be at the top of your class. It's so competitive to get in. But then I feel like once we get out of hygiene school, we just turn into teeth cleaners, and we're not using those critical thinking skills that we needed to get into hygiene school. And so I really think that it's so important, like, to have those critical thinking skills, to be able to look at the bigger picture, and be able to look at the mouth not just as a structure, but as part of the body. That's what we do at the Mouth Lab, is we think of the mouth as part of the immune system, the respiratory system, the vascular system. It's part of, all these systems in our body. And that's really the important thing, is to have an open mind about these things.
100%. And I come back to this all the time. Biology is never 100%. So like, just because something looks similar in a new body doesn't mean it's operating the same. So how we treat somebody is going to be different from our neighbor. It's just, there's so many variables to straddle. So Jazmin, tell us what you do for Mouth Lab. Although I do realize that we haven't exactly come from behind the chair to Mouth Lab. So at some point, if we could address that, that's also.
Yeah, totally. So, my background is in kinesiology and rehabilitation. So that's where I really, started to understand the interconnectedness of the body. But I started to see this pattern over and over again, where people were addressing other things in their body, like their gut or their inflammation. And the one thing that nobody was looking at was the mouth. And so when I eventually moved into the dental world, it was really neat to start to see how the mouth actually kind of ties back into a lot of these different things. It's the origin, right? It's the front door to the rest of your body. And that's really what I do for the Mouth Lab. Is I enjoy looking at that research. I like putting it into, easy ways for other people, not just practitioners, but also patients, to comprehend this complex kind of world that we're just starting to discover. And so I like to make things fun for people, and really take those really complex things into there. But I think one of the most important things that has led, that transition that you said from the chair now into Mouth Lab, was really that research. Angelina and I, so after treating patients, after starting our salivary testing and that whole journey of trying to figure out what is the thing that's going to finally work for our patients. Since we were in a holistic dental practice, a lot of our patients didn't want to go on antibiotic therapy. And at the time, that was really what was instructed by the salivary test companies, to use antibiotic therapy to remove these pathogens. But A, our patients didn't want that, and B, we know obviously the side effects or the drawback from taking an antibiotic, and that forced us to kind of keep pushing and keep digging and keep trying to figure out what was going to be the solution for us. And we came across spore-based probiotic therapy, and coupled with our protocol that we had kind of developed over the years, it actually was the thing that started to make the biggest difference in those bacterial shifts and in the clinical improvement of our patients. And we got so excited with that, and we continued, down that path, and one question leads to more questions and more and more and more. And you keep digging and trying to figure out, what is this answer? And so that led us to our research. Once we started to see, okay, this is working time and time again, let's go ahead and actually formalize this, and let's, write down some research, let's test some patients, let's do a pilot study. And so that's what we did. We took 6 patients from our practice, and we gave them the spore-based probiotic therapy. And that's where the Mouth Lab was really kind of born from, because this research was finally the door to proving to the rest of the world that this can be done in a natural way. And so, yeah, it's a small pilot study, and it is currently under peer review. So I'm excited to be able to share that whenever that comes through publication. But that was really the thing that pushed us forward and then we said, okay, let's do this whole mouth lab thing. Like, we know this works, it's reproducible, it's down on paper, and let's tell the world.
That's fantastic. I love that y'all had your own respective journeys that really like complemented each other when it comes to critical thinking, helping patients, but doing things in a way that still somehow is against the grain when it might seem a bit more obvious now. Right?
Yes.
Like, how's it been so disconnected for so long when it comes to the mouth and the rest of the body?
Right. Yeah, it's actually such an incredible discovery, and I hope more people continue to learn about this specific topic. I want patients to know about it. I want clinicians to know about it, because it was truly game changer for our practice and our patients.
I definitely want to dig into the space. So from my reading, it was a gut probiotic. And the unique factor is that it creates an endospore that withstands the gastric juices, so it makes it to its rightful place in the right place in the intestines, which would argue that we're reorganizing the gut microbes. So how did you fall across this novel application? Was it a patient who was just on probiotics and you started to dig in? How did this happen?
So it was actually quite a long journey. We started out with a lot of the oral probiotics that are on the market. And, we did see some improvement, but we weren't really seeing the improvement that we wanted. We wanted to get rid of those high-risk pathogens because we know they're associated with not just periodontal disease, but like heart disease, Alzheimer's, all of those leading causes of death that are in the United States. And so we started thinking about, how is the mouth really connected to the rest of the body? And so if I put a probiotic into my mouth and use it as a lozenge, what happens when I have that next sip of coffee or that acidic drink, or maybe my saliva is not the best, or how are those bacteria actually going to survive? And is it actually going to change anything in the long run, or am I just putting another Band-Aid on it? And the mouth is attached to the GI tract. So we know already that every time we swallow, that those oral pathogens are not just staying in our mouth, they're getting throughout the rest of our system. And so if I'm consistently treating those bacteria just in the mouth, what happens when those same oral pathogens get in the rest of the body? They're going to be in our gut. We can find them in stool tests. And so it really wasn't that big of a jump to take a probiotic. We take antibiotics for oral infections all the time. Why can't we use a probiotic? But I didn't want to just use any probiotic, because I can throw any probiotic into an inflamed system that's not going to survive. We would be in the same boat as we were with the oral probiotic, right? So I wanted a probiotic that was going to help improve the immune system. It didn't necessarily need to be antibacterial, because I don't need to kill off all of the bacteria. I just want to create an environment where those good bacteria can thrive. And so that's exactly what these spore-based bacillus probiotics did. They created an environment where the good bacteria can thrive, where it was less hospitable for the bad bacteria. And that's exactly what we saw in our testing, that slowly these red complex oral pathogens started to decrease. And that was what we wanted to achieve. And so, sometimes people are like, can I just take this probiotic and get rid of my periodontal disease? Do I need to do the testing? They are considered generally safe, but we always encourage testing before, because if you don't get the results that you wanted, we don't know where you started. And so it's very important to get a salivary test. So we always encourage patients, if your dentist doesn't offer testing, then that's why the mouth lab exists. But yeah, get a test so you know where you're starting. And people have lots of issues, right? So gingivitis or periodontal disease, I feel like it's the start, or it's the red flag that, hey, something's going on in your system, probably in your GI system. But, if a patient has like SIBO, IBS, IBD, we definitely need to communicate with the patient's physician or whoever's treating that issue, because we don't want to throw in anything that's going to like disrupt it.
Of course. I think you nailed it with the systemic linkage is through the gut. Absolutely. And, leaky gut, we've heard the analogy, leaky gums equals leaky gut.
Mm-hmm.
That's how we make the full loop. So if we shut down at least one of them, then we get a foothold.
Yeah, that was one thing that we did see too, is a lot of patients that are having treatment for leaky gut, they don't always get the results that they want with their treatment, which they should be getting. And a lot of times it's because the mouth is the missing link. And so if we don't treat the mouth, then you're going to consistently have this dysbiotic environment that's contributing to the gut down below. And so a lot of times once we get that oral environment under control, their GI symptoms improve greatly.
Yes. I've just a personal experience, though I've written a lot on this subject. I recently had 2 bouts of diverticulitis through a genetic disorder. And when I have like just even the mildest moment of like, oh no, I can tell that my gums are already mad about it. And it's wild. The connectivity is almost precision,
Yeah.
And it's wild. It goes both ways. Mm-hmm. Yeah.
In our study,
it's actually, I was just about to say what you're going to say, Angelina. Go ahead.
Go ahead.
Well, in our study, it was super interesting because although none of our patients that we did the study with, none of them really reported any sort of GI discomfort or any sort of GI symptoms. But after they did the probiotic therapy, they all reported improvements, even though they never realized that they had an issue. And so that's what we find often, is that it's after you get better that you actually start to understand just how bad you were prior to that therapy.
I think we all make a lot of concessions just to get through the day, and we forget how much tension or pain we might be enduring. I think that's a really interesting piece of systemic disease is, it starts low grade and it sneaks up on you until you're in deep trouble. And then by the time you get the test you're so far gone.
Right.
Wow. Yeah, it speaks to the resilience, right, of the body too. But without having the testing, the awareness, and a team of people to be able to connect those dots. Mm-hmm. Like you said, Camille, it starts low grade, but if it becomes chronic and persistent, it just becomes that much more challenging to combat without all these key details. To say
I mean, that's exactly how over 80% of people over the age of 35 have some form of gum disease. That's how we get there. It's silent. It happens. We see a little bit of bleeding in the gums. We need a little bit of mouthwash to cover our breath. And slowly we start to climb up this or go down this hill, I would say. And we don't realize it until something either hurts or until there's like an actual consequence to the symptom.
Yeah, right. When you have to sign up for gum surgery, you're really like, oh God.
Like what? Yeah, but, exactly.
One of the things that I was taking note of, and I was just trying to like understand your differentiation factor, and I think this is an important piece that I'd like to sit on for a minute. And that is like there's so many microbiome tests on the market today, and we could talk about differentiation between tests. And I think that, yours is handling genetic factors, salivary factors, systemic, you're demanding a blood test as well, just very small, but you're getting at like a more holistic tray of understanding the whole individual. So it's not just the mouth, but I want to even lean into this and say you're actually providing a clinical evaluation per case as well, right? Mm-hmm. I want to hear about this.
So I do think that, the clinical portion is very, very valuable. So right now we're just, we're virtual. So dentists will refer to us or medical providers will refer to us. We are working on getting a physical location so patients can see us clinically if they would like. But for right now, we're just working with dentists. So we do encourage patients to still continue working with their dentist, with their periodontist, with whoever's providing their oral health care, because we still need that. But a lot of these practices, either they don't have the time or the capacity to do their own testing, or maybe the education piece. And so that's where we come into play, is, just a partner where they can send their patients. And I think a lot of, dentistry has been so reactive. So once we see that bleeding, once we see that decay, then we're going to do something about it. But that's the nice thing about testing, is you don't actually have to wait until you see those symptoms. You can be proactive and see what all your markers look like beforehand. That way we can prevent these things from happening. You don't have to have bone loss, we don't have to wait until the bone loss starts to do something about it. So if we see those high risk pathogens or some other marker, then we can actually treat those before the destruction actually happens. And that's my favorite part, because that's why we got into this, right? Is to prevent disease, not to react to it.
Yes, and Camille, what you mentioned is very important to us, is that clinical evaluation, because I feel like there's not a lot of providers out there in the whole gamut that is going to actually take all these different puzzle pieces and try to fit the picture and figure out what that really says about where you are in your health journey. And that's one of the most valuable things that we bring to our patient. Like you said, we will request their labs, we will request their, any type of blood chemistries, any type of past medical history, dental records. We'll look at the whole thing for them and, kind of start to really piece this story. Angelina, I know you have a case that you really love to share, and I'll let you share that, because it really does kind of highlight that systemic connection and how, some things that we take for face value are actually much more complex under the layers. Go ahead.
Well, I wanted to bring back something you said earlier, in that, we're all taught that fluoride is a make or break you situation. And if the practitioner is ordering a test for their patient and working through you, they may be on that pillar of like fluoride or die, right? And no fault to them. That's kind of the standard of care, right? But to have a clinical value come in and speak to other possibilities, I think is the biggest differentiator you have. And I'm so excited to see that, because it's going to hopefully open people's minds around how they move forward with treatment like this. So now I want to hear about your case.
Oh, we do have one case. It was super interesting. The patient came to us. He had a biopsy. He had a growth. It was like right behind 8 and 9 on the palate. It was a pyogenic granuloma in a man. And so we know that typically we see those in women, pregnancy, hormone changes, things like that. And so for it to be diagnosed a pyogenic granuloma, that was really interesting. So we're like, what are we going to do with this? The patient was young. He was in his 20s, late 20s, early 30s. He did not want to, so the recommendation was biopsy and removal. He did not want to have it removed. He was like, I need to figure out why this happened. It it was pretty large. It was, I would say, like the size of a quarter. And so for me, thinking back about it, like if I was in my 20s and I was like, how am I going to deal with this? I would have been like, get that out of there. But I really love the patient's mindset that he's like, I want to figure out why this is happening. So I love that he sought us out, and he sought out alternate treatments. He didn't just seek us out. He got multiple opinions from other people. Long story short, we looked at some of his blood chemistries and his stool test. He had some elevated markers that were preventing him from detoxing, and it was affecting his hormones. And so once he figured that out, he went back to his doctor, got the hormones under control, did some detox, and lo and behold, it shrunk down. I have to follow up with him still, but it's pretty much gone last I talked with him.
Wow. That is
and so that's
amazing.
really interesting, because we know that pyogenic granulomas have a very high recurrence rate. And so, that's, I don't know, that's super exciting. It's like you're a detective.
Yes, exactly.
You are.
And I think that we have to have that mindset in the oral cavity, because it's really a reflection of your whole system. And to think that we can just, brush it like it's a dirty toilet is a mistake.
No, yes, exactly.
Yeah, that's what most people leave their dentist office with, right? Brush harder, floss more, use a mouth rinse. But those aren't fixing anything.
I mean, there's a reason we started 125
Yeah.
years ago with like floor cleaners and antiseptics that we were using in hospitals to clean. Like, that's the reason they came into the mouth. We just decorated them with mint, which is horrific. And I feel like we've come so far. Are we really doing that still? We are kind of.
I think it's important to note too, some people, they are still on the fluoride train, and they're just like, I want my fluoride. And even in our holistic practice, we did have patients that were like, I really want a fluoride treatment. But everybody's in a different position. And I think the biggest thing is the education. Let's see what your body is telling us on your test results. And then the patient can make the best decision for themselves at that point.
Agreed.
Whether they want whatever treatment, XYZ, I think it's important for people to be their own best advocates. Whether my opinion is for or against fluoride, they have to make a choice on what works best for them. And then we kind of go from there. And what your opinions are today might not be what they are, in 5 years or 10 years, because of what we learn or what the science that we see is changing. And so I think it's just very important to be able to grow and evolve and, just change. The science isn't staying static, and neither will our health. Our health is not static. So what's working today might not work tomorrow.
Exactly.
But we just have to be open.
I was just having a talk with the RDH people because I'll be speaking at Under One Roof, but I was actually just saying this is it's a relationship between us and our microbiome, and it is just like any other relationship in that we have this ongoing dialogue that changes depending on our mood and is reflected back to us by them. And so it's a constant negotiation. And, even with my friends and family, there are days when I want to run away from them, and there are days when I want to run to them and hug them, like it's the same. And so having that kind of mindset when we think of our ecological insides, I think is such an important element. Like each phase of life has a different impact. Each phase of life is going to give you a slightly different ecology. And like understanding that, I was just writing an article called The Metaphysical View of the Oral Microbiome, because it is always in flux. And it really, it isn't this fixed thing. And I would even hazard to say, like, testing at the front end of the day, when you're going to be, get up on a stage or fly across the room or whatever, do a whole lot of stuff, be high active, you might actually stress yourself into having a higher prevalence of Porphyromonas gingivalis, for example. And yet by evening time, you may not see that blip. It might be back down to like normal subclinical levels. That's not a big deal. And so I feel like it's so important to like keep an eye on everything to, really understand what is happening in our bodies so that we can respond effectively. Sometimes it is your mood. Sometimes you're just high stress, and cortisol plays a huge role in shaping your ecology. And so we can't ignore all of these factors. I love that you're
Yeah.
looking at more than just 5 microbes. So
Yeah.
important. The environment they live in is everything, right? That's us.
Yes. Yes. And also, one of the last things that I do want to mention regarding, how we work with patients and with clinicians is that we always want to make sure that we communicate back to their physician, their functional medicine provider, their dentist, whoever is actually taking care of them. We want to make sure we have like open, collaborative conversation with every medical professional in your life, because we should all be talking. We can't all treat, everything at the same time, but if we all communicate and have a plan for the better of our patient, I think that that's truly where I hope healthcare is going.
I hope that to be true. I know that there's been a lot of effort. I first saw it in HIV where the HIV patient, before we had it so well controlled anyway, the HIV patient over the aging process is going to experience a lot of differences in their pathology expression. Like in the olden days, before we had really nice sophisticated drugs, there was lipodystrophy, there was, all of these things that affected so many factors. They'd have an endocrinologist, they'd have a rheumatologist, they'd have an immunologist, they'd have, all of these people.
Mm-hmm.
And most of those people would be like, you have HIV, that's not my specialty. And so their infectious disease provider had to be the one and only. Like they had to own rheumatology and endocrinology and, all of these things that is just absurd. And so there were many clinics trying to give this unified approach. And I think that it does have to be collaborative. I love the idea of a my chart for the mouth, like something more comprehensive that everybody, you can share with your other providers.
And that's definitely what I hope people can get from this conversation and from, your socials and everything that we all are trying to kind of spearhead, is that it's truly about taking a step back and understanding that there are more tools than the floss, than the toothbrush, and then a mouth rinse. There's so much more that we have at our disposal, so many tools that are in our tool belt these days that there's no excuse.
So if I was a patient looking for treatment, or if I was a clinician looking for my next microbial testing partner, how would I find you?
If you're a patient or a clinician that is looking for, just a wider lens or a more deeper look into your oral health, you can always find us on our website, themouthlab.com. There's a clinicians tab and a patients tab there that you guys can look through. We have an awesome blog for all of our patients and for our clinicians. We explore Mouth City. We explain the way the microbes in your mouth live and the biofilm in your mouth. We explain that through a city. So our blog really explores every aspect of that city. It makes it fun, it makes it memorable, it makes it easy to understand. And for clinicians, we partner with them, whether you just need somebody that, can hold your hand through a case, whether there's a difficult case that you can't crack, or you want to investigate a little bit further into how this person's mouth is going to impact the rest of their body. There's many ways that we can work with clinicians, and you can come see us speak at MBKS if you'd like. If you're a clinician, that's a great way to connect with us. In September, we'll be in Nashville. And our social media, you can find us at the Mouth Lab on any socials, and you'll probably see us there talking about all things oral. So thanks for this platform. We're super happy to have had this conversation with you too.
Likewise, it's a mutual feeling. Actually, I want to gift you an image that we had created with an artist at the beginning of our venture with Let's Get Oral. And we at first we were ideating around a person walking through nature with an investigative eye. And we're, spelunking the natural environment to understand what is happening, right? Like we just really have to give this purview. Anyway, she drew up a really lovely image. It just wasn't exactly the punchy thing we were looking at for a logo. So I just kept it hidden, and I'll send that over to you.
Thank you. That's amazing.
Yeah, I think it's also very apt with y'all being in the Colorado area. Naturally, y'all have mountains.
Yes.
Yeah, we can use that. Yeah.
How fitting. Wow, that's amazing. Thank you so much.
So y'all offer all these amazing services between the testing, the interpretation of the results, and working literally hand in hand and mouth to mouth, there I say, with the patients and clinicians. Do y'all have plans to add any more services or products under your umbrella?
Angelina?
We are always looking to add more services or products. A lot of the products, a lot of times patients don't know where to go after they get their results, or where do I find these? So we do have ways for patients to get the products or supplements that we recommend. So we do have that going. We're always looking at adding new tests or collaborating with other labs on how to get patients the data that they need. So yeah, there's always room for growth. I don't foresee the mouth lab that's today will be the same mouth lab in 5 years. So I think that's how we should be in our careers, just in general. One thing that I always want, like for patients that are listening, one of the things I was thinking about today was, when we go to the dental office, a lot of times if there's a hole in the schedule, dentists will say, oh, we can get this done for you today. And that's great, because everybody's on a tight schedule. If I'm here already, can I just get it done? And I love that. But, there's hardly ever any extra time for us to say, hey, you do have a cavity, but let's figure out why it happened. And so it may be more beneficial to spend that time saying, hey, let's figure out why this happened versus, hey, let's just patch a hole, because you're going to come back in 6 months with another hole if we don't figure out why this happened. Or you're going to come back in 6 months and that bleeding is going to be worse, or the bone loss is going to be worse. And so I think maybe sometimes it's just nice to slow down. Let's look at the bigger picture and figure out, hey, I don't want to come back in 6 months and you tell me the same exact thing. I want to make sure that I'm going to keep my teeth for the rest of the life. And I don't want to spend a fortune, just doing patchwork. Mm-hmm. So I don't know, food for thought.
I couldn't agree more. I'd rather be on top of it and, create that resilience that we know exists there. The mouth is so dynamic. Yeah.
Everything affects our mouth, our diet, our nutrition, our lifestyle. What happens in the mouth doesn't stay in the mouth.
It's not Vegas. It's not Vegas in there.
It's not.
It's fun. We like to have fun. It seems pretty, science can be pretty heavy, and sometimes it's confusing to people with all the big words or whatever. So that's part of the reason why we created Mouth City, just to make it a little bit more approachable and understandable. The mouth is just part of the bigger picture. And that's how we made Mouth City, to kind of show how it connects to every other section, every other city in our body. And so Mouth City was, it started out as an apartment complex and then kind of grew from there.
Yeah, now it's a city.
I love that. I'm waiting for the animated production of this city.
Yeah.
Oh. That would be actually super cool.
I know. I can see Jazmin's wheels turning already.
Yep, just planting a seed.
Totally.
Well, I'm so excited for you. I have all sorts of thoughts. Yeah. And
Tell us your thoughts.
I can't wait to see you. Yeah. Well, I'll keep those private. We can share offline, but I don't want to give away all the secrets, right? But I do think you have a lot of potential here, and I'm excited for you.
Oh, well, thank you.
We appreciate that.
Yeah.
Before we sign off, we tend to end these conversations a little bit stepping away from the oral care, and again, getting back to just learning a little bit more about you all. So if you don't mind, could you share if you're digesting or consuming any new media, whether it's TV show, movies, a book, a video game? What's occupying your free time these days?
Work. Writing vlogs.
Yes.
Filming content. But on my free time, I actually really like this show that I actually just finished. It's called Secret Millionaire on Netflix. Have you guys ever watched it?
I have not. I've never heard of it.
Oh my goodness, you're in for a treat. That show is super cool because it gives a contestant $1 million and they have to hide the fact that they're the millionaire. And if people find out that you're the millionaire, then they can vote you out. And so it's like it's a game of deception. And I think that's really cool.
Interesting. Okay,
Yeah.
I'll have to check that out.
It's very interesting.
I am also a fan of reality TV, but if we're not working on Mouth Lab stuff, my life is consumed with baseball because my son plays baseball, so we're constantly on the field. Yeah. I also have 3 grandkids that like to run around and keep us busy. So
that's lovely.
So
we have
kids. Not watching any shows.
Yeah, no shows really. I have a long catch-up list building.
I see. Maybe some Bluey if the grandkids are running around.
Oh no.
Yep.
Well, once again, Angelina and Jazmin, thank you so much for joining Camille and I here at Let's Get Oral. It was great to learn so much more about you all each, and also learning about Mouth Lab and all the wonderful things you're doing for your patients, and also being able to help other dentists and clinicians when it comes to bridging the mouth to the rest of the body. And we look forward to continuing to follow you and hopefully see you all at a meeting or conference sooner than later.
I would love that.
That would be incredible. Yeah.
Yes. Thank you so much for having us.
Of course. Y'all have a great one.
Let's get oral.
Thanks. Bye-bye.